Hello, thank you for bringing your dog into the veterinary referral center. And your dog was referred to us today for a possible torn cranial cruciate ligament in their knee. So we did our exam, and on exam, I want to explain to you what we found and then what our recommendations would be to help your dog recover from this injury. So cranial cruciate ligament injuries in dogs are the most common orthopedic problem we see in veterinary medicine. We see here in our practice several hundred a year. And the history that you explained to me over the phone is pretty typical for most dogs that we see here in our practice. So to give you an idea of what I was able to see on exam and feel on exam, I have this model here that demonstrates exactly what the anatomical structures are of the knee and what ligament your dog is injured. So this is a model of what the dog's knee looks like. This is the tibia, this is the femur, this is the fibula, this is the kneecap or the patella, this is called the straight patellar tendon. The cruciate ligament, there are two of them inside the joint. The one that's the red rubber band represents the cranial cruciate, so that's the ligament your dog has torn. The job of that ligament when your dog walks is to prevent the tibia from moving forward in this direction. We call that a tibial thrust or a cranial drawer. So what I was feeling on your dog on exam, I was grabbing the tibia, grabbing the femur, and I was able to make that tibia move forward on exam, which is not normal. A dog with a healthy knee, there should not be any movement of that tibia on exam. We call that a positive cranial jaw test. So like with us, when a dog tears its ligaments, the ligaments don't heal. So if we did nothing over the course of time, that inflammation that is developed from that tibia sliding forward, back and forth, causes damage to the cartilage and then results in arthritis. So we recommend doing surgery on a dog to restore that stability so that tibia doesn't slide forward anymore, so your dog can get back to running and jumping and using that leg the way it's supposed to. So the surgery we recommend doing on your dog is called a tibial plateau leveling osteotomy, or TPLO. And this model shows very nicely the before and after. So what's happening inside the leg now with the ligament torn, and then how the surgery corrects for the instability. So we have foot, ankle, tibia, femur. Ignore that pin and plate just for a moment. The red line again represents the torn cruciate. So when your dog walks, when that foot strikes the ground with that ligament being torn, this is what's happening in the leg. That tibia slides forward. And that's the reason why your dog doesn't want to put a lot of weight on that leg. So how the surgery corrects for that instability is we actually don't replace the ligament. We do something to the bone, specifically the top part of the tibia, that will allow us to take that force, which is pushing that tibia forward, and take that force and redirect it so that the force goes up so the tibia doesn't slide forward anymore. And how we make the force go from that to that is by changing the angle of the top part of the tibia relative to the shaft. We call that angle the tibial plateau angle. So what we'll do before surgery is we'll take an x-ray of your dog's leg, and off that x-ray we measure what this angle is relative to the shaft of the tibia. The goal of the surgery is to make that angle smaller. So most of our dogs on average, their angles prior to surgery are about 30 degrees, and the goal of that surgery is to get that angle to less than 10 degrees. So we determine the angle before surgery, then we go in the OR, we're going to shave your dog's leg, we're going to make an incision on the inside part of the leg that allows us to get good access to the top part of the tibia. We then take a specially designed saw, it's a U-shaped semicircular saw, that allows us to cut the top part of the tibia, which contains that plateau. So we cut that top part of the tibia with that semicircular blade. Then we're going to take the top part of the tibia once we've cut it and slide it back. And by doing that, we're now making that plateau, top part of that tibia, more perpendicular to the shaft. We're making that angle smaller. Once we make our cut, that's where this plate's going to come in. The plate is then used to hold these two pieces of bone back together to allow it to heal in this new orientation. So the goal of the surgery is again to make this more perpendicular to that. Once we've accomplished that, now when your dog walks, as that foot strikes the ground, the force is going to go from that to that. So as your dog walks, that tibia is not going to slide forward anymore. The joint is going to be stable. The recovery time for your dog is going to be about 8 to 10 weeks. The first 4 weeks is no running, no jumping, rough play, or excessive stairs. So basically what that means is on a leash to go outside to pee poop, do his or her business, then come back in the house. We'll see your dog at 2 weeks to take the sutures out, as there'll be sutures on the inside part of that leg. We'll then see your dog again at 4 weeks. Depending on how things are going at 4 weeks, that's when we'll start your dog's rehab. And your dog's rehab is simply just increasing or starting to take your dog for longer walks over the second 4 weeks. And at that 4-week recheck, we'll go over specifically how we want you to do those increases in walks over the second 4 weeks. Then we'll see your dog again at 8 weeks. At 8 weeks, we'll re-x-ray the leg to make sure that bone is healing. It takes healthy bone about 8 weeks to heal. Once we see we have good healing at 8 weeks, then we'll get your dog back to normal activity. The plan would be to admit your dog into the hospital this morning. We would do surgery this afternoon. We will call you to tell you the surgery's been done and tell you how things are going. Your dog will spend the night in the hospital with us. We have 24-hour care, so someone's with him or her at all times. You're more than welcome to call anytime at night to check on your dog. Your dog will be on pain medication throughout the evening. Most likely have a urinary catheter in place so that your dog stays nice and clean and dry overnight. Tomorrow morning, have you give us a call in the morning around 7:30 to see how things went overnight. If your dog is doing well in the morning, we do our discharges sometime before noon that following day. Once you pick up your dog, the following day we'll go over again everything in detail with you. We'll have everything written down as far as the restrictions, incision care, and medications. Your dog will go home on pain medication for 2 weeks and also an antibiotic for a week. If you have any questions, once your dog has been discharged, you're more than welcome to give us a call at any time. And also we'll make available to the preoperative and post-operative x-rays so you can see how we change that angle on the procedure that we have done. Thank you.